Good Health is sponsored by Sullivan County Community Hospital.
Well, you've probably heard that people over 60, and especially those over the age of 70, and those with underlying health conditions are at the greatest risk of getting COVID-19. But why? Melissa Rainey takes a look.
An underlying or pre-existing condition is any chronic or long-term health issue that can weaken the immune system. And when you're fighting a virus, we need our immune systems to be in top shape. According to the U.S. Centers for Disease Control and Prevention, these are some of the conditions that can affect the body's response to fighting the coronavirus. Lung disease, asthma, or heart conditions. All of these impact your body's ability to fight the virus, which is known to attack the lungs. This in turn forces the heart to work harder. Those who are immunocompromised because of ongoing medical treatments like organ recipients or perhaps those who have HIV or AIDS. Severe obesity, that's anyone with a body mass index of 40 or higher. Diabetes, kidney and liver disease, and neurodevelopmental conditions may also put you at higher risk of a serious infection with coronavirus. And of course, age. According to the CDC, adults 65 or older are not only more likely to have long-term health conditions, but our immune system weakens as we get older. If any of these apply to you, now more than ever, it's important to stay home and stay safe. For today's Health Minute, I'm Melissa Rainey.
Meanwhile, another study suggests the coronavirus in children is generally mild. Italian researchers looked at 18 studies involving more than 1,000 children who were diagnosed with COVID-19. Most of the kids had either no symptoms or very mild symptoms, such as a fever, dry cough, or just being tired. In general, kids recovered in about 2 weeks. Well, NBC's chief medical correspondent, Dr. John Torres, tells us that there is a thing you should know today about the virus.
Hi, Dr. John here with what you need to know about coronavirus today. It's Thursday, April 23rd. Here's the headline. Fears of coronavirus are keeping people from going to the emergency room even if they need to. Now, many patients aren't heading to the hospital in a medical emergency because they're afraid of getting infected. Physicians report seeing a significant decline in the number of patients with heart attacks, strokes, and appendicitis, but that doesn't mean there are less of them. They're just not being treated. I'm an ER doctor, and what's especially concerning to me is delaying treatment for any life-threatening condition could be deadly, and your chances of getting COVID in the hospital are low. Now, hospitals have special precautions and safety measures in place to protect patients from exposure. Some even have coronavirus-only floors. So it doesn't matter if you have a large cut that won't stop bleeding, think you have a broken bone, or are having symptoms of a heart attack or stroke. In an emergency, don't hesitate. Get to an ER. Now, we're learning more about this virus every minute, so tune in to learn more tonight on NBC Nightly News.